Hey John, so if you can tell us about how you've been using the STAK tool at Exeter.
So over the last few years, we've been establishing a painful knee and a stiff knee pathway. So this is where we're trying to avoid patients having further surgery. So we've had our post-op patients who we've identified early as having a problem with stiffness. They have not reached their 90-degree range of movement by 4 to 6 weeks. And what we've been doing is we've been getting them early into a pathway with physiotherapy. And we discussed with them the options, ensure that their knee pain relief is adequate, and we then get them on board with our physiotherapist to then decide whether or not they're appropriate to try the STAK knee stretcher. So we've been getting them involved and putting them in touch with yourself at STAK, and actually found that a really useful tool for a certain group of patients, stopping them requiring the manipulation or further surgery.
Do you know what sort of impact it's had? How many manipulations do you think you've prevented?
So I think it's probably every other patient who's stiff. I think we're certainly improving their range of motion and not requiring a manipulation. I think it's multifactorial. It's not all necessarily related to one thing, and it's education, pain relief. But I think the stretcher tool, the slow, continuous passive stretching, I think is a really important, valuable tool in the management of post-op stiffness.
Yeah, because they can do it every day between their physiotherapy sessions and successfully break down that scar tissue.
Yeah.
Have you? Could you tell us a little bit about any success cases that you've had?
Yeah, there's a patient of mine, Howard. We've talked about him before, and so he had a difficult knee with a very sort of low patella before we started. So technically the operation all went very well. But I saw him at his 2-week follow-up, and he was very stiff, 0 to 30, 40 degrees. Didn't really understand what he was trying to achieve by getting the knee movement, was scared about moving his knee. So we got him involved early with our physiotherapy team. We put him in touch early with the STAK tool, and actually he's been able to achieve a really, really good outcome. So I was worried that he was going to have a really poor outcome, sadly, but actually he's now bent his knee more than most people. It gets 120 degrees. So it's shown that it can be a really effective tool.